Radial catherization is a newer catheterization technique where we can look at the coronary arteries by entering the radial artery in the wrist. In the past, we had predominantly done femoral catheterization, which is where we enter the artery in the leg and then go up with catheters to the heart to shoot contrast dye and take pictures of the coronary arteries. Over the years, we kind of have transitioned now to doing more radial catheterizations in the United States than we had previously. The advantage of radial catheterization is that there's less bleeding complications, there's a shorter hospital stay, especially if a patient ends up getting a stent, which can also be placed through a radial catheterization, and overall lower hospital costs. So femoral catheterization, tends to be, have a higher bleeding risk. There tends to be just more costs associated with complications that might arise from bleeding. And in general, it's starting to go out of favor as compared to radial catheterization. And so I tend to start with a radial heart catheterization in most patients, and if we can't get into the radial artery, sometimes we have to go into the femoral artery, and there's about a less than 5% chance of that happening. But we tend to try to start with a radial catheterization first, and patients tend to do better and have more satisfaction doing a radial heart catheterization to look at their coronary arteries rather than a femoral heart catheterization.